I am about to say something that makes some of my colleagues uncomfortable. And I want to be honest with you from the very beginning. This is not a video designed to scare you away from doctors or medical care. This is a video about something far more important than that. It is about understanding what you are actually agreeing to before you say yes. Because here is what 20 plus years in medicine has taught me. Sometimes the most dangerous thing you can do for your health after 60 is get too many tests. I am Dr. Victor Hayes, and today I am going to walk you through 4 medical tests that I see causing real harm to real patients, particularly in adults over 60. Not because these tests are useless, but because for certain people at certain ages, the risks quietly outweigh the benefits in ways nobody explains to you at the time. Before we get into the specific tests, I need you to understand one concept. Because once you understand this, everything I'm about to say will make complete sense. It is called the cascade effect. Here is how it works. You feel perfectly fine. You go in for a routine screening. The test finds something, maybe a small spot, maybe a shadow, maybe a number that is slightly off. Now here is the critical part. That finding might be completely harmless. It might have been sitting quietly in your body for 20 years and would sit there for 20 more without ever causing you a single problem. But the moment it is found, the doctor has to act on it. Because what if they do not? What if it turns out to be serious? So they refer you to a specialist. The specialist orders a more detailed test. That test is still not conclusive. So now we are talking about a biopsy, or a procedure, or possibly surgery. And each one of those steps carries risk, infection, bleeding, complications, anxiety, lost time, lost sleep. And at the very end of all of that, 9 times out of 10, you find out it was nothing. It was never going to hurt you. But now you have been through months of fear. You have had procedures. You may have had complications. And you are worse off than when you started, all because of a single test you got when you felt completely fine. That is the cascade. And it begins with one test that perhaps you never needed at all. The first test I want to talk about is whole body scanning, full body MRIs or CT scans that promise to check everything at once. You have seen the advertisements. Come in. We will scan you head to toe, catch anything before it becomes a problem. The idea is genuinely appealing, complete visibility, total control, and I understand why people say yes to it. But here is what actually happens. You are 65 years old. You feel great. You are active. No symptoms of anything. You get the scan just to be safe. 40 minutes later, you walk out. And a few days after that, you get your results. The report mentions a small nodule in your lung. 3 millimeters, about the size of a pencil eraser, or perhaps a cyst on your kidney or a shadow on your liver. The report recommends follow-up imaging in 3 to 6 months. How do you feel in that moment? You walked in healthy. You walked out being told there is something in your body that needs watching. You cannot stop thinking about it. Every deep breath reminds you of that lung nodule. Every twinge in your side makes you think of that kidney cyst. 3 months later, you go back for another scan. The finding is still there, slightly different. Hard to say. The radiologist recommends a specialist. The specialist recommends a biopsy. The biopsy means anesthesia. It means a needle going into your lung or kidney. It means real risk of infection and bleeding. And here is what the research actually shows. When you scan healthy people over 60, you find something unusual in almost everyone. We are talking about 90 to 95% of people. Small spots, small cysts, tiny shadows. The medical term for these is incidental findings. Things discovered by accident, and the vast majority of them will never cause any problem at all. They are simply what the inside of a body looks like after 6 or 7 decades of living. But once we find them, we cannot ignore them. Studies that followed people who received whole body scans found something striking. The people who got scanned did not live any longer than those who did not. They did not avoid any serious diseases, but they did experience significantly higher rates of anxiety, depression, and unnecessary medical procedures. The scans did not make them healthier. In many cases, the scans made them worse. What should you focus on instead? Rather than getting a picture of your insides, pay close attention to how your body actually performs. Can you walk up 2 flights of stairs without losing your breath? Can you rise from a chair without using your hands? How is your balance? How is your sleep quality? How is your energy throughout the day? These functional indicators tell us far more about your true health than any scan ever will. If you want a meaningful health assessment, sit with a doctor who will actually spend time with you, someone who will go through every medication you are taking, someone who will talk honestly about your diet, your activity, your sleep, your social connections, because those everyday factors are what genuinely determine how healthy you are and how long you stay that way. The second test is brain MRI for mild everyday forgetfulness. Here's the situation I see constantly. You are in your mid-70s. Sometimes you cannot recall the name of an actor you like. Sometimes you walk into a room and forget why you went there. Completely normal things, the kind of things that happen to virtually everyone as they age. But your family is worried. They have heard about Alzheimer's. They push you to get a brain scan just to put everyone's mind at ease. And I understand that fear deeply. Nobody wants to think about losing their memory, but here is what I need you to understand clearly. Getting a brain MRI for ordinary, mild forgetfulness is almost never helpful, and it is often genuinely harmful. Because here is what happens when you get that MRI. You sit down with your doctor a few days later to review the report, and the report uses phrases like mild cerebral atrophy, age-related white matter changes, small vessel disease. These words sound alarming. They sound like your brain is deteriorating. They sound like a diagnosis. But here's the truth. Those findings are completely normal for someone in their 70s. That report is simply describing what every brain looks like at that age. It is like scanning your skin and being surprised to find wrinkles. Of course there are wrinkles. That is what skin looks like at 75. The problem is that medical language does not sound normal. It sounds like disease. And suddenly, you are walking around believing you have brain damage, believing Alzheimer's is right around the corner, even though functionally you are completely fine. Studies have shown that when healthy people over 75 receive a brain MRI, more than 90% of them have findings that look abnormal on paper. More than 90%. But the majority of those people have perfectly normal memory and thinking. The image does not match the reality. What should you do instead if you are genuinely concerned about memory? There are simple assessments we can do directly in the office that take about 10 minutes and actually measure how your brain is functioning, not just how it looks on a scan. And if those assessments reveal a real concern, the next step is identifying the cause. Because most causes of memory changes in older adults are reversible. It could be a medication causing cognitive fog, low vitamin B12, untreated depression, which very commonly presents as memory trouble in older adults, sleep apnea cutting off oxygen to the brain at night, a thyroid problem. We investigate those causes first, and you would be surprised how often correcting one of them brings memory function right back. No MRI needed. If someone is progressively worsening, getting lost in familiar places, unable to manage finances they previously handled with ease, that is a different situation entirely. That warrants a full evaluation, including imaging. But for the ordinary forgetfulness that accompanies normal aging, a brain scan creates more problems than it solves. The third test surprises people because it sounds so logical. Routine cardiac stress tests simply because you have reached a certain age. Here is the typical situation. You are 72 years old. You are going in for a routine surgical procedure, nothing major, a hernia repair or a knee replacement, and hospital protocol requires a cardiac stress test for everyone over 70 before surgery. Even though you feel completely fine, even though you walk several miles a week without any chest discomfort or shortness of breath. Think about that for a moment. If you are already walking several miles in your daily life without any problems, what exactly is the treadmill going to tell us that your daily life is not already telling us? You are passing your own real-world stress test every single day, but protocol is protocol. So you get on the treadmill, and here's where it becomes problematic. Stress tests have a high rate of false positive results in older adults. The test flags something abnormal when nothing is actually wrong. It could be because your heart rate no longer elevates the way it did at 40. It could be the medications you are taking. It could be any number of factors completely unrelated to a dangerous blockage. But once that result comes back flagged, you are on the medical conveyor belt. They schedule a cardiac catheterization, a tube threaded through an artery all the way to your heart to examine the blood vessels directly. It is invasive. It carries real risk. And often, after all of that, what they find is exactly what you would expect in a 72-year-old heart. Some plaque, some natural narrowing, nothing requiring a stent, nothing that was about to cause a heart attack. But now you have been through an invasive procedure, and you have been labeled a heart patient. New medications are added, and the psychological damage quietly takes hold. Maybe you were playing golf or taking long walks before all of this, but now you are afraid to exert yourself. A test that was supposed to protect your health has instead stolen your confidence and your activities. What is the better alternative? Listen to your own body. That is the most reliable stress test available. If you can climb stairs, walk at a comfortable pace, and perform your normal daily activities without chest discomfort, unusual breathlessness, or dizziness, your body is already telling you your heart is managing well. Those are the symptoms that matter. Chest discomfort with physical effort, unusual shortness of breath, lightheadedness. If you experience any of those, absolutely get evaluated. That is the appropriate time for a stress test. If you want to understand your future cardiovascular risk, there is a much better tool. It is called a coronary artery calcium score, a quick, low-radiation CT scan that takes about 5 minutes. No treadmill, no needles. It measures the amount of calcified plaque in your arteries and gives you a number. A score of 0 means very low heart attack risk over the coming years. A high score means it is time to get serious about prevention through diet, exercise, and possibly medication. The key difference is this: the calcium score informs your decisions. It guides prevention. It does not automatically send you down a path of invasive procedures based on a false alarm. The fourth test is one I know will be controversial: routine colonoscopies after the age of 75, specifically for people whose previous colonoscopies have been normal and who do not carry special risk factors. And let me be absolutely clear before I continue. I am not against colonoscopies. They are a genuinely valuable tool. I recommend them beginning at age 45 or 50. They prevent colon cancer by allowing us to remove polyps before they ever become dangerous. If you are in your 50s, 60s, or early 70s and you are due for one, please get it done. Do not let this video stop you, but here is the reality. Every medical test is a balance between benefit and risk, and that balance shifts as we age. The benefit of a colonoscopy is preventing a cancer that, if it develops, typically takes 5 to 10 years to cause serious problems. Now ask yourself this: if you are 78 or 80 years old, is that benefit still worth the risks involved? Because the risks are real, and they increase with age. The preparation alone involves drinking large volumes of liquid that can leave an older person significantly dehydrated and physically weakened. The sedation required carries greater risk of confusion and respiratory complications in older adults than in younger ones. And then there is the risk that concerns doctors most: perforation, a tear in the colon wall. As we age, the colon wall gradually becomes thinner and more fragile. The risk of the scope accidentally creating a perforation roughly doubles or triples after age 75. And a perforation is a surgical emergency. It means emergency abdominal surgery. It sometimes means a permanent colostomy. For an 80-year-old, that kind of operation can mean the end of independent living entirely. Now weigh that against the benefit of preventing a cancer that would take years to develop into a life-threatening problem. For someone whose remaining life expectancy is less than 10 years, the mathematics simply do not work in favor of routine screening. The procedure is more likely to cause serious harm than the cancer it is trying to prevent. This is why most major medical guidelines now recommend stopping routine screening colonoscopies somewhere between the ages of 75 and 85 for average risk individuals. This is not a blanket rule. If you have a family history of colon cancer, if you have had significant polyps in the past, or if you have inflammatory bowel disease, the calculation is different, and your doctor needs to weigh those factors specifically with you. But for the average person with no elevated risk factors, continuing routine colonoscopies deep into your 80s is likely doing more harm than good. What do you do instead? You shift from invasive screening to smart symptom awareness. Pay close attention to any persistent changes in your bowel habits, any blood in your stool, unexplained abdominal discomfort, unintended weight loss, new fatigue. These are the signals that matter. If any of those appear, age is irrelevant. You need to be evaluated immediately regardless of when your last colonoscopy was. And invest in your diet. This is genuinely powerful prevention. Fiber is the single most protective nutritional factor for colon health. Fruits, vegetables, legumes, whole grains. Fiber nourishes the beneficial bacteria in your gut, and those bacteria produce compounds that actively reduce inflammation and cancer risk throughout your colon. Eating more lentils, more leafy greens, more oats, more apples, that is prevention that benefits your entire body with zero procedural risk. So there are the 4 tests: whole body scans, brain MRIs for normal forgetfulness, routine stress tests based purely on age, and colonoscopies after 75 without special risk factors. Do you see the pattern connecting all 4 of them? The cascade. One test leads to another, which leads to a procedure, which leads to a complication, and somewhere in the middle of all of it, the most important question stops being asked. Is this person actually better off? Because here is what I have learned over more than 20 years in this field. Health is not about achieving perfect test results. Health is about function. It is about being able to do the things that matter to you, spending time with the people you love, taking walks, reading, traveling, living with independence and without unnecessary fear. The goal at 65 or 70 or 80 is not simply to survive longer. It is to live better. And sometimes the most powerful thing you can do to protect that life is to pause, ask the right questions, and say no to a test that is going to send you down a path you do not need to be on. Be a smart patient. When a test is recommended, ask why. Ask what happens if the test finds something. Ask what the actual risks are. Ask whether there is a better alternative. And then make a decision based on what matters most to you and your life. You are in charge of your own health, not the protocols, not the automated reminder system, not the guidelines written for the average patient in the average situation. You. If this video gave you something useful, please share it with someone over 60 in your life who might benefit from hearing it. A parent, a sibling, a close friend. I am Dr. Victor Hayes. Take care of yourselves, and I will see you in the next video.